So what I thought I would do today is I'm going to provide a rationale really for the work that Rob and my colleagues in Bristol were doing on developing a water test that could be used in remote areas where you might not have access to electricity and lab facilities. So what I'm going to do is I'll sort of set the kind of policy context almost for the work that Rob and his colleagues have been doing. So the big kind of piece of policy news around water is the Millennium Development Goals. And in fact, we've got Target 7C, which is to halve by 2015 the proportion of the population without sustainable access to safe drinking water. So in fact, those of you who were watching the news this time last year might have heard Ban Ki-moon celebrating the fact that between 1990 and 2010, that was one of the first Millennium Development Goal targets to be met. So there's a big kind of fanfare there about that target being met. So that all sounds very encouraging. Is it time to sort of slack off a bit and stop worrying quite so much about water? Well, probably what we should do first of all is just have a quick look at what's behind the figures. So if we have a look, in fact, the joint monitoring programme that monitors that target, what they actually do is use a sort of pragmatic indicator in the absence of data to monitor what's going on with that target. So we have a thing called the ladder, if you like, of different types of water source. And essentially we've got, on the basis of how protected different water sources are, almost a hierarchy of different sources. The ones at the bottom here, things like hand-dug wells and unprotected hand-dug wells, surface waters, they're considered unimproved and therefore unsafe. And then higher up, at the top of the ladder, we've got piped water, and lurking around somewhere in the middle, we've got standpipes in the street, tube wells, boreholes, protected wells, protected springs, rainwater, lurking somewhere in the middle. So we've got almost a sort of pragmatic approach to monitoring progress towards that target based on available data. So that sort of sounds pragmatic, straightforward, based on the degree of source protection, and you can see things like bottled water are considered unprotected because of the unimproved because of the sustainability issues there. However, probably a large number of people in the room might have had an experience something like this. I'm not sure you can see that quite so well. This is me doing a spot of field work in a place called Kirinyaga in Kenya. After a day in the field, I ran myself a bath. It might not be that clear given the lighting conditions, but if you were to look at the kind of quality of the water coming out of that tap, you'd probably be a little bit concerned about maybe considering that improved or in some way safe. There's lots of sort of sediment in there and you might be a little bit nervous about it. So that then almost leads you to a kind of more general question, which is, if you were to move away from just monitoring internationally this progress towards this safe water target in terms of the type of source and started to include some sort of a water quality dimension to it, what impact would that have on progress towards that target? Well, you can sort of see that the target was formulated in the way it was because of an absence of internationally comparable data that cover the entire population. However, since that target was formulated, there was a series of UN-sponsored surveys that attempted to sort of capture water quality data from various places around the world. And they were designed to give a sort of spread of different countries. The set of surveys were called the Rapid Assessment of Drinking Water Quality Surveys. And they focused on places like Nicaragua, Nigeria, Ethiopia, Jordan, Tajikistan, as a sort of cross-section of almost interesting case studies. There were also places like Andhra Pradesh in India, one province of China and Bangladesh, but some of the Asian studies didn't work out quite as well as they were originally hoped. So this sort of gives us an interesting data set to almost play around and have a look at that target with. So the interesting thing about them is that they're nationally representative. They're designed starting with the population and then moving back and looking at the water, rather than going the other way and thinking about an engineering issue and looking at the integrity of, for example, a pipe supply system. So the starting point is the population. They're cross-sectional, which is perhaps a bit of a weakness, and they cover a sort of core set of parameters, the ones that you'd be most concerned about. So things like thermotolerant coliforms, a marker of bacterial contamination, indicator bacteria. We've got things like arsenic, fluoride and nitrate as being some of the chemical parameters that you might be most concerned about from a public health standpoint. So what would happen if you were to sort of introduce the data from these surveys and then take a look at progress towards those MDGs? So here we go, we've got the 5 countries in which the RADWQ surveys took place here. And then we've got 3 bars on each of these graphs. So you can see here the left-hand bar is the bar that tells us about the existing monitoring system, the system that's currently used. The middle bar then adjusts that for microbiological contamination. And then the right-hand bar adjusts for both microbiological and chemical contamination. So if the microbiology and chemistry are going beyond guideline values and are looking unsafe, then you adjust the amount of safe water downwards. So in terms of, we've got 3 different bars here, and then in terms of colours, if you like, what we've got is the Millennium Development Goal monitors progress from 1990. So if you like, we've got bars representing the situation in 1990. We've then got the amount of progress that has been made up until 2008, and then the amount of progress that would be required to meet the 2015 target. And if we were to sort of have a general look here, what you can see in terms of the 3 bars is that actually the microbiology really kind of pushes things back quite a lot. So you can see the amount of progress required in places like Nigeria and Tajikistan. Actually, that yellow bar is getting quite a lot bigger, Nicaragua, Nigeria. But introducing the chemistry doesn't make a huge amount of difference beyond what's happened with the microbiology. So, and in some countries like Jordan, actually there isn't really a huge amount of difference when you add in this water quality, because what comes out of the pipe there is pretty good. More generally, water quality, if you were thinking about these targets, I've been talking about water quality, but there are lots of other aspects that people are interested in. Equity, things like the environmental footprint and the financial sustainability. Of course, all of these things interact, so we could go further than what we're talking about here. In particular, you could imagine that water quality might interact with some of the other issues that we have on the slide here. What we'll take a closer look at now is the idea of water quality and how that might relate to a policy interest now, which is in the equitable delivery of safe water. So when you look at the poorest sectors of society, has that sort of general progress been uniformly experienced across all of the population, or are the poor somehow lagging behind a little bit? So we're coming in from a water quality perspective, but if we were to look at some of the latest reports coming out of the United Nations, in the past couple of years, what's started to happen is that in those reports, people have begun to actually graph out progress by the wealth, different wealth socioeconomic quintiles or different groupings relative to the types of source that people are using. And you can kind of see here, if you focused on the poorest people who have the least access to assets and services, in urban areas, far fewer of them. If you look at the unimproved sources here, quite a lot of them are drinking shallow groundwaters or buying water from vendors and so on. And over here again, there are lots of people drinking surface water among the very poorest in society. So we've just seen, this is the sort of perhaps the way things might move beyond the Millennium Development Goals. So you might ask yourself, what would happen if we introduced some water quality into this situation? Well, we've just said actually there isn't very much data in this sort of general area. So in fact, the data are pretty sparse. However, there are a few places that would let us have a little bit of a picture. And in fact, in Peru, there is some nationally representative survey work that took a look at chlorination in piped systems. So if you were to have a look at the percentage of households with adequate chlorine in their water, and you'd assume that adequately chlorinated water would inhibit bacterial growth, actually what you see is, even amongst people who are using piped water, that the very poorest households, very few of them actually have adequately chlorinated water in comparison to the richest households. So you could imagine actually if you were to sort of incorporate some water quality, that disparity that we saw in the last slide would probably be even greater in the specific context of Peru. Unfortunately, it might be quite hard to generalise because one of the other few places where we've got very detailed information on this is Bangladesh because of the arsenic problem in groundwater there. And if you were to look amongst groundwater users, tube well users of deep groundwaters in Bangladesh, actually the position isn't anything like as clear, and there's quite an even spread and perhaps almost a counterintuitive picture amongst the richest there. So with exposure to high levels of arsenic, that pattern's not quite so clear. Okay, so far we've kind of seen a little bit about water quality and how that interacts with the sort of international monitoring policy environment, measuring progress towards the Millennium Development Goal, but also measuring that kind of gap between the wealthiest and the poorest as well. Underlying it all, you can kind of see that there's been an issue around not having an appropriate testing technology that you could use everywhere, even if you're very far and remote from the nearest laboratory and you're lacking access to electricity and trained staff and so forth. So you can sort of see underpinning that nationally representative survey, this is the sort of locations where testing were taking place in Nigeria, and you can see that some of the dots, the coloured dots that represent the testing locations, are really a long way away from the nearest lab. Some of these places up here in northern Nigeria, you'd have a pretty hard job on your hands gathering water quality testing data from those locations. So that's part of the rationale for the work that Rob will be demonstrating later. But I'll maybe also just illustrate another test that's actually been widely used for the past 30 years. This is a really, really simple kitchen sink test for hydrogen sulfide producing bacteria, where you have a little chemical cocktail in a 20 ml container, typically 20 ml to keep the costs down. And this is a South African chap in northern South Africa testing a groundwater source for bacterial contamination using this cheap test. There's the little testing vial going off to be incubated just at ambient temperature, and then what will happen is that this will change colour to a darker colour in the presence of hydrogen sulfide producing bacteria as a rough marker of contamination. And about 30 years ago that was shown to be correlated quite strongly with more conventional indicator bacteria that would indicate fecal contamination by an Indian academic called Manja. So you might ask yourself, in fact, this test is quite widely used in South Asia. It's being used here by the South African government. You might ask yourself whether there's a need for a further test, given that we've got this kind of technology which is being used in some places already. let's have a closer look at this issue. Well, in fact, there have been lots, because this test's been around for quite a long time, there's quite a big literature out there that takes this hydrogen sulfide test here and compares this simple presence-absence of bacterial contamination against laboratory-based methods. And what you can do, what a lot of people have done, is to make a comparison in which you've got presence or absence according to the field method, the H2S test, and presence or absence according to the lab method. And obviously you could have, sometimes the results match up, and you'd hope that they would do, and occasionally you get false positives or negatives where they don't necessarily match up. So we've got a kind of lab test versus a non-lab test. So one of the bits of work we did in Aquatest alongside the policy work that we had there was to try and do a sort of systematic hunt through the literature and take a look at the very large literature comparing this existing test with standard lab methods. So what we did was almost set up a fishing net that we could plug into some bibliographic databases with some terms for lab tests, terms for field tests, and terms to do with the water being tested. And on the back of that, we then having set up our fishing net, we caught quite a lot of fish and ran them through, if you like, a mesh to make sure they were the right kind of study. And then at the back end, we ended up with 51 studies drawn from around the world, making this comparison of these two tests. When we took a look, actually what you can do is to plot out the test performance, almost ability to detect negatives, if you like, contamination-free samples versus ability to detect actual presence of contamination. On these graphs, I won't say too much about them, but you'd expect the perfect test to be up in this top left corner, and a completely randomly performing test to lie somewhere on that diagonal line. And we've got two different types of standard indicator bacteria in the lab on the two sides. If you have a look, the kind of methods that are approved by the US Environmental Protection Agency are represented by the crosses, and then the performance of this simple lab-based test, all the various studies are the dots here. So what you can see is actually there's quite a lot of scatter on that graph, and that in some cases some of these studies really don't seem to be performing much better than random. So at times the test's performance is variable, sometimes it looks pretty good, on average it's moderate, and at times it's no better than random, depending perhaps on specific local circumstances and how well the homebrew kit has done in terms of, quite often it's a cottage industry making these hydrogen sulfide tests. So there's some sort of evidence on that. And you might think, well, that's a sort of mediocre-ish test. It's pretty good, it's not perfect, but it's incredibly cheap. Why don't we just roll it out and use it everywhere? Well, one of the things that you have to keep an eye on, of course, is that, well known to medics, is that really people are only going to respond to a positive test. And so the numbers you want to keep an eye on are positive tests that the field test has got right, shaded in green here, versus positive tests that have come up positive on the field test, but actually they're false positives. A lab test would show them as dubious. And were you to sort of have a reasonable amount of contamination around, actually on the whole, on balance, you'd have more of these true positives than false positives. However, even if we were sort of plugging in a typical H2S test performance, if we then changed to a situation where water source contamination was comparatively rare, that balance of true versus false positives would switch, and actually the correctly called tests would be far outweighed by the number of false alarms going off. So you can see there's a sort of specific issue there that may be some particular circumstances where you'd want to proceed with caution. And in fact, you might think, is that just a theoretical effect? Well, here's the percentage of samples that might be called as contaminated according to the lab test And then there's that proportion of what's going on with the field test, the proportion of true positives expressed as a proportion of all the positives according to the field test. And you can sort of see there that actually once we get down to low levels of contamination, where only a few of the sources are contaminated, on the whole we're getting more false positives than true positives going on. So you can sort of see you want to proceed with caution perhaps where contamination's rare with that test. So let's just sort of sum up a little bit. I hope I'm getting this about right. You can kind of see that that existing method is incredibly cheap and very simple to use, which is great, and that we shouldn't underestimate the value of that in any way. But what that would suggest is that this sort of homebrew test kit has very variable accuracy. So if you are going to use it, it would be pretty sensible to evaluate it in your local context using your kit and your operators before you go any further. And what's more, you probably want to also proceed with caution if you are interested in tracking down a few contamination events or contamination sources, contaminated sources against a backdrop of relative water safety in microbiological terms. So in that sort of situation, you can kind of see the logic behind the test that Rob will be presenting later on, the Aquatest device, which is outside. And indeed, in the interests of fairness, I should point out there are some other test kits around, such as Del Agua as well. So that's really the rationale for Rob's kit. And finally, let's go out more generally to the wider issues. You can kind of see, although that target 7C, the Millennium Development Goal targets, met, given the way in which the indicator is framed for that, actually there's still quite a long way to go if you incorporate things like water quality in tackling this issue of safe water access. And you can sort of see that actually field diagnostics for remote areas, actually they're kind of important both in sort of keeping tabs on how we're doing as a technology that might help inform our understanding of progress towards that global target, but also they've got a role in remediating unsafe water, you know, protecting a source and then trying to work out whether or not that's worked. Final point, Rob's been working on an incubator. My background is, as you can probably see, rather more kind of policy related. It's multidisciplinary research week. And this is very much, you know, looking at that slide that had environmental sustainability, financial sustainability, social equity, and a bunch of water testing as well. It's very much multidisciplinary stuff and a key part of tackling a problem like this.